Cultural representation of borderline personality disorder, BPD, impact of stereotypes on stigma and understanding. The portrayal of borderline personality disorder, BPD, in popular culture, through movies, TV shows, and books, has a significant impact on the stigma surrounding the disorder and the public's understanding of it. Unfortunately, BPD is often subject to misrepresentation and stereotyping, which can reinforce harmful perceptions and contribute to the marginalization of those affected by the disorder. These portrayals frequently depict individuals with BPD as unstable, manipulative, or dangerous, leading to misconceptions about the disorder and perpetuating its stigma. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore how the stereotypes surrounding BPD in popular culture contribute to stigma and misunderstanding. We will also discuss how positive representation can help challenge these stereotypes, foster empathy, and ultimately lead to better support for those living with BPD. 1. Common stereotypes of BPD in popular culture. The media plays a central role in shaping public perceptions of mental health conditions, and BPD is no exception. Some of the most harmful stereotypes of BPD that appear in movies, TV shows, and books include 1.1 The crazy or unpredictable person. One of the most pervasive stereotypes of BPD is the portrayal of individuals with the disorder as irrational, dangerous, or unpredictable. This stereotype often exaggerates the more extreme symptoms of BPD, such as emotional outbursts, impulsivity, and self-harm, making individuals with BPD appear as if they are completely out of control. Example in media, in movies like Fatal Attraction and Girl, Interrupted, characters with BPD are often shown as violent, obsessive, or irrational. While these portrayals may reflect extreme aspects of BPD, they do not capture the full complexity of the disorder or the underlying emotional pain that drives these behaviors. Such depictions contribute to the idea that people with BPD are dangerous or unpredictable, which reinforces the stigma and creates fear or misunderstanding. 1.2 The manipulative person. Another common stereotype is that people with BPD are manipulative or attention-seeking, particularly in relationships. This stereotype implies that individuals with BPD intentionally cause emotional chaos or distress in others as a way of getting attention or manipulating situations. Example in media, the portrayal of Alex Forrest in Fatal Attraction is often cited as an example of the crazy ex-girlfriend trope, where Alex's behavior, her obsession with her former lover, appears to be driven by manipulation and deceit. However, this stereotype overlooks the fact that much of the behavior in BPD stems from fear of abandonment, emotional dysregulation, and lack of coping mechanisms, not from intentional manipulation. 1.3 The emotionally unstable or flawed person. BPD is frequently depicted as a condition marked by severe emotional instability and lack of control over feelings. People with BPD are often shown in the media as constantly shifting between intense emotions, such as rage, depression, and ecstasy, without the ability to regulate their feelings or make decisions grounded in reality. Example in media, in Girl, Interrupted, Winona Ryder's character, Susanna, struggles with emotional outbursts and periods of deep despair, which are exaggerated for dramatic effect. While the film highlights the emotional pain and instability associated with BPD, it doesn't fully convey the complexity of the disorder and often reduces the character's emotional turmoil to something dramatic and chaotic. 2. The impact of stereotypes on stigma. The stereotypical portrayals of BPD in the media contribute to a cycle of stigma, where people with the disorder are misunderstood and marginalized. This stigma can manifest in several ways. 2.1 Negative public perception. The portrayal of individuals with BPD as unstable or dangerous can lead to the general public viewing people with BPD through a lens of fear and misunderstanding. These misconceptions make it harder for individuals with BPD to find empathy or support, both from society at large and from healthcare providers. People with BPD may find that others are reluctant to engage with them or offer help due to these ingrained stereotypes. Consequences: this stigma can discourage individuals with BPD from seeking treatment or discussing their struggles openly for fear of being judged or dismissed. It also creates an environment where their experiences are not validated, and their suffering is minimized or misunderstood. 2.2 Internalized stigma. Stereotypes about BPD can also lead individuals with the disorder to internalize these negative perceptions, further damaging their self-esteem and sense of worth. If someone with BPD is constantly portrayed as being manipulative, irrational, or dangerous, they may begin to believe these stereotypes about themselves, deepening feelings of shame and hopelessness. Consequences: internalized stigma can create a barrier to treatment, as people with BPD may feel ashamed or unworthy of help. It can also contribute to a lack of self-compassion, preventing individuals from addressing the root causes of their behavior and from seeking healing or support. 2.3 Barriers to treatment and support. The negative media portrayals of BPD can influence how mental health professionals approach diagnosis and treatment. A clinician who holds biased views due to stereotypical representations may dismiss or downplay the complexity of BPD, leading to improper treatment or misdiagnosis. In some cases, people with BPD may be labeled as difficult patients, which further alienates them from seeking help. Consequences: this can lead to a lack of proper diagnosis or ineffective treatment plans, further complicating the journey to recovery. Individuals with BPD may be given medications that address symptoms of depression or anxiety, but the core emotional and interpersonal issues may remain unaddressed. 3. The need for authentic representation. To combat the stigma surrounding BPD, it is essential for the media to move beyond harmful stereotypes and offer more authentic and nuanced portrayals of the disorder. These portrayals should focus on the humanity of individuals with BPD, highlighting their struggles with emotional regulation, self-worth, and fear of abandonment, rather than reducing them to caricatures of emotional instability or manipulation. 3.1 Nuanced portrayals. More realistic portrayals of BPD in movies, TV shows, and books should showcase the emotional pain and vulnerabilities of individuals with BPD, rather than focusing on extreme or sensationalized behaviors. These portrayals should acknowledge the complexity of the disorder, offering viewers a deeper understanding of how BPD impacts daily life and relationships. Example in media. TV shows like The United States of Terror and films like Silver Linings Playbook have offered more nuanced portrayals of characters with emotional instability, showing that people living with mental health disorders can also have compassion, resilience, and the ability to heal. While these portrayals are not perfect, they provide a more balanced view of the experience of living with BPD. 3.2 Fostering empathy and understanding. Accurate and compassionate portrayals of BPD can help foster empathy and challenge the negative stereotypes associated with the disorder. When the public sees that people with BPD are not defined by their impulsivity or emotionally intense behaviors, they are more likely to view individuals with BPD as whole, multifaceted people who deserve support and understanding. Impact. This shift in perspective can encourage more people to seek help without fear of judgment, and it can improve the quality of treatment provided to individuals with BPD. It can also help individuals with BPD feel less isolated and more confident in their healing process. 4. Conclusion. The stereotypical representations of borderline personality disorder, BPD, in the media, particularly in movies, TV shows, and books, have a profound impact on stigma and public understanding of the disorder. Negative portrayals that depict individuals with BPD as unpredictable, manipulative, or dangerous contribute to a cycle of misunderstanding and marginalization, both for the individuals with BPD and for society as a whole. However, more nuanced and compassionate representations can help challenge these stereotypes and provide a more accurate, humanizing portrayal of the disorder. Through empathetic depictions, we can encourage greater understanding, reduce stigma, and foster an environment where individuals with BPD can seek the support and healing they need. In future episodes, we will continue to explore how media shapes the public's perception of borderline personality disorder and discuss ways to encourage accurate, compassionate, and empowering portrayals of mental health. Stay tuned for more insights into BPD and its cultural representation.